Doctors are noticing a frightening trend: patients coming in much sicker and people being diagnosed with much more advanced cancers. Dr. Matthew Abudara is here to explain another concerning side effect of the pandemic. So, Dr. Matthew, you're part of St. Luke's Lung Screening Task Force. What is that and why is it so important?
Well, our lung screening task force here at St. Luke's is principally involved with implementing and educating providers and the public regarding lung cancer screening.
Why is early detection key, especially when it comes to lung cancers?
Probably more than 60% plus of the lung cancers that we're seeing within the St. Luke's health system are these advanced stage 3 and 4 lung cancers. Unfortunately, this was a problem that we were seeing even prior to the pandemic, and so this just got exacerbated by the pandemic as a result, which is one of the reasons why preventative lung cancer screening is so critical in the right patient population.
And we've mentioned early detection is key. Why is it so important, especially when it comes to lung cancer?
Lung cancer is the #1 cause of cancer-related death in the United States in both men and women, and it has so for decades. And one of those reasons is that for many decades, we have not had an effective tool in order to screen patients. And so that changed approximately about 10 years ago with low-dose screening CAT scan that was shown to actually give a mortality benefit for these patients in the right patient population. One of the issues with lung cancer is that the lungs don't have any nerve fibers. So somebody may have a small spot there that's been there for a while, and somebody may not notice that they actually have a problem until they start to experience symptoms. So they might start to experience shortness of breath, they might start to have chest tightness, they might start to cough or even cough up any blood. And at that point, it's too advanced, and most likely in those situations, it probably can't be cured, which again highlights the incredible importance of trying to identify it early.
That is so important. And we know that St. Luke's does offer the low-dose CT lung cancer screening that you were just talking about. Who qualifies for this?
So if you fall in the range between 50 and 80 years of age, you may qualify. However, it's highly encouraged and recommended that you follow up with your primary care provider or somebody who's knowledgeable at lung cancer screening to see if you qualify. If we hone in a little bit more on that patient population, particularly the Medicare beneficiaries, it's those 55 to 77 years of age who would qualify. Now, the second point to that, whether you would qualify for not, is whether you have a smoking history. Principally, what we're looking at is whether you have smoked what we call a pack year for 30 pack years. If you smoked 1 pack a day of cigarettes for 30 years, or an equivalent of that, for example, you smoke 2 packs a day for 15 years, and if you smoke that much and you are either a current smoker, or if you've quit within the past 15 years, you certainly may qualify for lung cancer screening. And the third thing to consider is if you don't have any of those symptoms that I just mentioned. So if you're not having chest pain, if you're not having coughing or coughing up any blood or any abnormal weight loss, essentially any signs or symptoms that may be concerning for cancer, then you could qualify for lung cancer screening.
Well, thank you for all of that, Dr. Abudara. Good information to share with our loved ones.
You're most welcome.
For more information or to find a doctor, just go to stlukeskc.org.